factors can contribute to this. It may be down to illness. So if somebody's feeling very unwell, they might be feeling nauseous and very anxious about the illness, and that can lead to them having no appetite. Sometimes people, as they get older, find that their taste and smell changes. So foods that previously they really enjoyed eating, they no longer enjoy them. Dementia can quite often lead to weight loss, and this can be because of lack of appetite. Sometimes it can be somebody doesn't recognise the feeling of hunger anymore, and they may forget to eat. Also, they may be unable to shop and prepare food for themselves as they used to do. It could be that somebody has a swallowing problem, and that's going to mean that they won't be able to eat as much food. If this is the case, it's really important they talk to their GP about that. It could be that a dry mouth can result in somebody eating less than they used to, and this can be through illness or sometimes side effects of medication. And of course, poor dentition. So if somebody's got dentures that don't fit very well, or maybe some teeth missing, or just painful teeth when they eat, that can lead to weight loss. Medications can also affect appetites. So, for example, if a medication causes constipation, that can sometimes lead to a loss of appetite. And of course, feeling depressed and lonely can sometimes cause people to lose their appetite as well. It can be just a lack of interest in food. And these are just some of the reasons that somebody may be experiencing a poor appetite. And of course, I really must stress here, it's really important that if somebody is finding they're losing their appetite and they're losing weight, that they talk to their doctor before they do anything else. So what can we do to prevent further weight loss? Well, we're all very different, so solutions will vary between individuals, but I'm just going to mention some of the things that you might want to try. So try to eat little and often. So include snacks. So it may be that if you can manage to eat something every 2 hours, this will help to stimulate the appetite. So it may just be a small biscuit or half a banana or a few spoonfuls of something, but try to have something to eat or drink every 2 hours throughout the day. Something else you can do is to fortify food. So fortifying food means adding extra calories and protein to your meals, so that you're not increasing the portion size, but you are increasing the nutrients in that food. So even if you can only manage a few spoonfuls of that food, every spoonful is packed full of nutrients. If you like milky drinks, that's a really good way of getting extra calories and protein into your diet. So something like a milky coffee or Ovaltine, hot chocolates, or a milkshake, or just milk by itself. That's a really good way of increasing your intake of calories and protein. And then it may be that you need some nutritional supplement drinks, and these you can buy from the chemist or from your doctor if you feel you need them. So what is food fortification? So it's a means of increasing the nutritional content of a food without significantly increasing the size of the portion. So because somebody with a poor appetite isn't going to be able to eat a larger portion of food. And so you can add extra calories to food by using some cream or some butter or cheese or nuts. And if you want to add some extra protein to the food, you can use milk powder, nuts, cheese, or eggs. So these ingredients won't significantly increase the size of that portion, but it will really, really increase the amount of calories and the amount of protein. And so food fortification is really an excellent way to make sure that every mouthful that somebody eats is going to be packed full of calories and protein. So sometimes when we talk about food fortification, people ask, well, isn't eating all that amount of sugar and fat bad for you? And of course, for somebody who's a healthy weight, or maybe is overweight and has got a good appetite, it wouldn't be a good idea to eat lots of fat and sugar, particularly saturated fat, because it may be that then you would put on weight, and then you increase your risk of diabetes, high cholesterol, and high blood pressure. But for somebody who's got a poor appetite, who's losing weight and who's underweight and is continuing to their weight continuing to decrease, the priority is to consume as many calories and protein as you possibly can to prevent further weight loss. Because what happens when you lose weight, especially if you lose weight rapidly, you will lose fat cells, but you also will lose muscle cells. And so this can lead to weakness, and somebody may become very frail, and even lose have a loss of mobility if they lose weight too quickly and become too underweight. And so as fat and sugar is very high in calories, somebody with a poor appetite who's very underweight, it's absolutely fine for them to eat fat and sugar, as well as other nutrients as well.